We are going to talk about what ultrasound is most commonly known for. Babies! Welcome to Sonographers in the Cities. I'm Lynn.
And I'm Giselle.
Thank you so much for tuning in and or watching.
Yes, welcome to the episode all about babies. And I think a lot of people actually are very interested in OBGYN and MFM. I get a lot of comments about it.
I get a lot of comments about MFM and fetal echo.
Oh, yes, fetal echo. I believe MFM also will do some fetal echo.
Yes.
So this is exciting, and I hope you guys stay tuned for this episode and our future episode where we're going to feature an OBGYN sonographer. And this is what everyone thinks about when they think about ultrasound. OBGYN.
Babies.
Yes, babies. So, but before we do babies, you have to know the female pelvic system, really,
Anatomy.
and
Yes.
anatomy, and that's what the GYN part of OBGYN is. So I think we should start with GYN gynecology, go into obstetrics, and then kind of gear into MFM, which is the highly specialized sonographers.
Disclaimer, I'm still in school. I am taking OB2 next quarter. So this mostly, I'm going to let Giselle take the lead on this. And I'm going to, ask questions and then, just be on the audience side.
The student side. Well, you are still learning. You had OB1 already?
Yes.
And did you have gynecology separate from that or?
No, it was OB and gynecology. Okay. We learned a lot about anatomy.
Mm-hmm.
And then OB2 is more about pathology.
Mm-hmm. Okay. Yeah. So, usually OBGYN, obviously, you have to know what is holding the baby in the first place and how everything works, from the period aspect to when someone can get pregnant, as well as the risks that can happen when you have gynecological symptoms like pelvic pain or vaginal bleeding. So those are things that OBGYN sonographers typically know. So a lot of times if you go into ultrasound to do babies, you're an OB sonographer. But you also have to know pelvic stuff because at OB offices, some people will have just regular pelvic ultrasounds done. And a lot of times these offices do very specialized exams more than in the hospital setting. So obviously I work in a hospital and we do very limited OBGYN stuff in hospitals. Unless you have a labor and delivery that does like more detailed exams, you won't really have to do very detailed exams in the hospital setting. So even my expertise on OBGYN and MFM is very small compared to others out there in the field. So if you guys are listening on the podcast, tune into the YouTube video where I'll put the description below, like information of other MFM sonographers and OBGYN sonographers that you guys can look into that have a lot of experience in this. But this is really just a deep dive for you guys to understand, the little things that we do in OBGYN and the things you can expect from MFM sonography. So, Lynn, let's see. What do you know about like pelvic exams and why would somebody need to order a pelvic exam?
Oh my gosh.
Let's see what you've
learned.
My
gosh. I have been on a break for 3 weeks. And I'm blanking out because you're putting me on the spot. I have light here.
No worries. Well, I put it up on my internet page here so I don't leave anything out.
I see.
But
Okay,
some indications.
If it comes to mind, I will say something.
Okay. So
I know that vaginal bleeding is one of them, and pain.
Pain. Yes, two most popular things. So vaginal bleeding and pain. Now, there's a lot of things that can cause vaginal bleeding and pain, right? But so indications for some GYN ultrasounds are pelvic pain, abnormal menstrual cycles or missed menstrual cycles, postmenopausal bleeding, ovarian cysts, uterine fibroids, or IUDs where they put them in, or if they're just following up for the IUDs. as well as other pelvic procedures. So those are some of the general things that they would order a pelvic ultrasound for. And then for OBGYN, so for babies, they would order these for dating. So how far along is somebody? Evaluation of the fetal anatomy, growth, and the well-being of the baby. Also, they check the baby if you have bleeding in pregnancy, because miscarriages, while they're very unfortunate, they are very common, as well as pelvic pain in pregnancy, as well as you might have a premature rupture of membrane. So that's like when your water breaks early on when baby is still premature, or even just a rupture of membranes later on when you're about to have baby. I've had some exams, labor and delivery. They want us to check the baby and then evaluate the fetal position. So is the baby head down or up? And there's a lot of types of obviously ultrasounds that they can order for OBGYN, but the protocols are typically the same depending on how early the pregnancy is, if it's an early pregnancy, like really early before 6 weeks, or if it's a first trimester, which is up to 12 weeks, or a second and third trimester, which is after 12 weeks. So depending on how far along your pregnancy is how your protocol is going to be. And then some exams are more intense, like anatomy exams or BPPs, which is a biophysical profile where you're watching the baby breathe and move and checking fluid and all that good stuff. So I think you'll probably learn that in your OB2.
Everything is coming back to me now. Like everything you say, I was like, oh yeah, I remember this. Oh yeah,
Yes.
BPP. Oh yes, this. Yes.
Yeah, but I work, since I do limited stuff in the hospital, I don't really know full anatomy wise. Like I couldn't sit here and tell you the whole entire protocol, but it's pretty much you're checking everything on baby, from like everything in the brain, everything in the abdominal cavity, to the spine, to how many fingers and toes are on baby, to the nose, face. They check for cleft palate. So there's just so much that goes in OBGYN. It's not just looking at a baby and not just seeing if they're, alive. Like you have to check.
Or trying to take a picture of their face.
Right. Like everybody like has this thing where they think it's so easy to be an ultrasound technologist, but it really takes a lot of skill. It takes a lot of patience, especially because this baby is moving around and like tumbling in the belly. So OB can get really difficult. And that's why a lot of people actually don't like OB once they get into the field, is they realize how difficult it actually is. A lot of people go into ultrasound thinking I want to scan babies, and then they realize, oh man, that's a lot of stuff I need to know and learn, a lot of pathologies, a lot of abnormalities, as well as a lot of difficult things that you have to deal with, like miscarriages and fetal demise and ectopic pregnancies, which is a pregnancy that's not in the correct space. So usually a pregnancy is in the endometrium, and that's where the gestational sac, or the little, I guess you could say, the home of the fetus, should be in the endometrium, but that can also be implanted somewhere else in the wrong spot. So if that happens, that's pretty life-threatening, and you have to catch that. And that can be very dangerous if it's not caught and if it ruptures. So it's a very, I'd say, high pressure setting, especially if you're an MFM. Now, MFM is just everything OBGYN, but to a next level type specialty. You're very much so with one mom throughout the whole pregnancy. It's somebody who has high risk pregnancy, or someone with twins, triplets, quadruplets. Like I can't even imagine having to measure 4 in there, but you can have up to 4. Or it's patients who have heart conditions, patients with, lung problems, or just anything that kind of affects the pregnancy in the long run. So if you want to do MFM, it's very rewarding because you have to be with that mom and with that baby for a long period of time, and you're watching that baby and helping that patient get through, a hard 9 months of their life, while being kind of like their rock and the person to help them get through their scans. So, it's very worthwhile to do OBGYN, but it's very challenging at the same time.
I agree. I think it's even more challenging than echo because of so many pathologies could be going on with the mother and or the fetus, and then for scanning as well, because you touch upon like the baby's moving, constantly moving, and you would have to kind of know where to put your probe and all the technicalities of it. I've thought of it when I was scanning in labs. I'm like, this is really difficult because the heart don't move like babies do. So you have to figure out where the baby is and scan the protocols.
Yeah.
It's super challenging.
Mm-hmm. Yeah, and just like how it's our job, right? For let's say for you, Lynn, being an echo, sonographer, you're gonna have to find those abnormalities in your patient's hearts. Well, being an OBGYN, MFM sonographer, you're gonna have to find abnormalities not only in the mom, but in the fetus as well. So you have to find, okay, are there fibroids in this patient's uterus? Okay, but she's pregnant. Okay, so will the fibroids affect this pregnancy? Okay, so now we have to watch the pregnancy. Okay, is there anything affecting the fetus? Now let's check all of the fetus's heart, kidneys, bladder, spine, brain, legs, arms, feet, fluid, placenta, the home of the fetus. And you have to look at all of that and watch it. And pregnancies are difficult because a lot of stuff is beyond the patient's control, but also we help them get through their pregnancy. And a lot of times, I think MFM is really special because you have to watch whatever's going on with the fetal issues. If they do have issues, like let's say the fetal echo, if they have a heart issue and they find that, you have to keep an eye on that and watch it. They call them like congenital because it's something that you were pretty much born with, and you have to keep an eye on that. And there are great sonographers on Instagram and YouTube who share different pathologies and abnormalities and how you can find those. And hopefully we can have some of them on the podcast in the future, but there's a lot of them who take their time to share those, like trisomies and all different pathologies from the heart. And it's quite interesting. And I feel like that's a lot of pressure, and I don't do that. But I always give them props because that's a lot of things to know.
I totally agree. Just from, learning about anatomy itself, because, the female reproductive system is so complicated already. And I was like, how are we supposed to learn more about babies on top of female anatomy? And it's just like amazed that these OB sonographers and OB sonography students are, going for it because, it's not an easy specialty.
Mm-hmm. Yeah, it's definitely not easy. When you learn scanning, I know because you were in lab and you had one of those.
The Phantom.
Yeah, phantoms. Did you do pelvic exams on the Phantom or just babies?
We did do pelvic exams, like a transvaginal.
Oh,
so the Phantom has transvaginal. It was also together with like the first trimester. It was actually, let me see if I say this correctly, heterotropic pregnancy.
The
one with two.
Heteroectopic.
Ectopic.
Very close.
See, I got hetero.
Heteroectopic, yes.
Yeah, heteroectopic. So it was the intrauterine pregnancy and the extrauterine pregnancy. So we get to learn both. It was really, really nice. So we have that one. And then we have the second trimester where we learn how to do, I want to say head circumference. And then biparietal diameter. And then abdominal circumference.
Yep.
And femur length.
Yeah, look at that. You did a whole measurement.
I had to close my eyes and remember.
Yeah. From head to toe, you're doing the measurements for baby.
Yes.
And that's how you get a fetal weight. Scanning all of those measurements, it does an average. And for my hospital, when we do our limited labor and delivery, second and third trimesters, or even in the emergency room, those are the measurements we take, as well as the AFI for the fluid. We check placenta. We also check cervix. And that right there is the whole limited second and third trimester scan. So actually, second and third trimester limited exams for us in the hospital are very quick, and it's for viability. So to check to see if baby is okay. And that's essentially what they're doing in a hospital or an emergency setting. So it's not a place where we're supposed to look at gender. It's not a place where we're supposed to look at anatomy. It's just to make sure, hey, is baby okay? Hey, is mom okay? And that's what the hospital setting is, at least at mine, and what it usually is for. So that's pretty much part of my scope. But if we do see something abnormal that sticks out to us or something like that, we will mention it, of course, but we are not a specialty OBGYN office. We do not have OB doctors reading our exams. We have radiologists reading our exams, and we don't have high risk pregnancy at my hospital. So if that's the case for someone, they will be at an actual MFM or high risk OBGYN office, as well as just regular OB offices. A lot of OB offices actually have their own sonographers, and they will contract them out or hire directly in their facility. So let's say you're somebody that's listening that wants to do OBGYN, your options for becoming an OBGYN sonographer is working in a clinic setting, so an OBGYN office, or for a specific OBGYN doctor. Some of them have machines in their office, and some of them actually don't, and they'll just send their patients out to do an ultrasound somewhere else, like an actual radiology department. So you have to kind of find where you want to work. I actually have had some friends who are like, oh, are you interested in working for this doctor? He's looking for an OBGYN sonographer. And so I'm like, I mean, I don't really like OBGYN that much, but I'll like spread the word to whoever else wants to do OBGYN all day. But that's an option. You can work alongside a doctor and be really cool. Like, for example, Christy DMS, she's one of the most popular sonographers on social media, and she does OBGYN and she works in an office setting. I know recently she's been going to different doctors' offices, so you can also do that too. And I've also seen back in the day when we had Leah on our podcast, the very first place she worked at was OBGYN, and they scheduled a ton of exams. So not only was she scanning pregnancy, she was also doing normal pelvic exams and IUD checks and things like that. But it can get really busy in an OBGYN office setting. A lot of times they stack their patients and they have a full schedule. And it's a very busy thing because there's lots and lots of pregnancies every single day, and people are getting checked up every single day. And there's also procedures in OBGYN. So it's definitely a field that will continue to grow. And I hope that people actually they scan first in their programs, like in lab, and they see what they feel like. Like, I want you guys to know that when you do OBGYN, you have to be able to move your probe all around. You can't just stay in one spot, and you can't just think you're going to get baby in one spot one way. That way you're going to see it every time. No, because every baby's different, every patient's different, and every scan is going to be different. So OBGYN really gives you the opportunity to be able to play around with your machine and your probe, and you have to have a lot of skill to do OBGYN. And I mean, it's one of the most, I think, fulfilling careers. You can see everyone who does it on Instagram, how much they love doing it. I don't know, just as much as I love doing ultrasound on everything else, people love doing ultrasound on just OBGYN patients. And that's it. That's something that you are interested in. You should definitely look into it, look at videos, do your research, and, see what it's like, because it can get tough. There can be tough days. just like there's tough days for any sonographer.
I was just so lost into all the things that you say. I'm like, yes, this is true. Yep, this is true. I resonate to this. This is true. Yeah, I hope to everyone who's listening to this, if you're a prospective student or incoming student or current student, since it is fall now, and that you're in OB or interested in OB, this is your future. You know, the job market is growing for ultrasound and especially for OBGYN as well as MFM. MFM is really growing and, you know, we just need more sonographers, and this is a big opportunity for all of us and for you too.
Yeah. Yeah, there's so many people that are hiring. And obviously, we talk about it in our past podcast where if you know someone, I'm sure that that person can help you get a job, especially if they're in the same area or if they're in another area that you're looking to move into. I know that Texas is one of the most growing fields, and a lot of the people that I've seen on Instagram are in Texas, and a lot of them are still looking for sonographers. And California too, it's a little bit more, I think, what's the word? Like there's so many cities, and just so much to kind of find in a general sense. Like you have to kind of pinpoint where you want to look, like what specific city and area. You can't just do this whole broad research. I think it has to be more specific when you're doing your job research. But it'll be a little bit harder, I think, when the city is so big because there's just so many options and so many people are trying to get jobs too. Like I know a student who was having a hard time in her city in California that she couldn't really find a job, but she just recently found one out in, I believe, Portland. So, you know, you might have to move to find some experience or a job that's going to fit you. But at the end of the day, if it benefits you, gets you that experience, it'll help you in the long run. Because you guys, after graduating, you need to have experience and you can't just have this like empty space of not scanning, because if you're not scanning, you're going to lose all your skills that you had in clinical. Pelvics were really hard for me because they were the last thing I learned in clinical, and as well as vaginal ultrasound. So yes, we do vaginal ultrasounds where the camera goes in through the vaginal canal and we scan to see the uterus and the ovaries. And that can be a really difficult thing to learn because going from holding a probe on top of someone's belly or body to holding a probe internally and searching around, especially with a patient who could possibly be in pain or who could not be comfortable with that exam or could have vaginal bleeding. So it becomes kind of difficult in that sense where you have to really make sure the patient is comfortable and understand how to do the exam. Finding ovaries is one of the hardest things about ultrasound, is finding
I
an
struggle.
ovary.
That's my biggest struggle.
Like
Chocolate chip cookie. That's
Yeah.
why where's the chocolate chip cookie?
chocolate chip cookie. That's the one thing I think most popular question people ask is like, do you have any tips to find the ovaries? You know, and it's one of those things where you have to, it's kind of like, oh, do you have any tips to find the pancreas? You know, and it's one of those things where each person is different. Some people's ovaries sit really high. Some people's ovaries sit really close to the uterus. And you really have to move that probe all around to find the ovaries, and you really do have to apply some pressure to find those ovaries. So these are things you're going to learn in clinical. Ask all the questions that you can when you are in clinical, because the minute you're out of school in clinical, you're kind of on your own. Unless you have someone there that's willing to help you, you're on your own trying to figure out how to get the best images for your patients. And so I just know that pelvics and OBGYN were one of the hardest things for me. So if that's something that you think is going to be hard for you, definitely spend more time and attention to that in your clinical setting. But once you get the hang of it, it gets easier. And I mean, I can say that I can do pelvics. I'm comfortable with doing pelvics and OBGYN. I just wouldn't be able to do a full anatomy scan for OB. Like I don't know how to scan a fetal echo. All I really know how to do is to make sure it's beating. You know?
That's the most important.
Yeah, you'll learn your protocols and clinical, and every place is different. So just like
Oh,
we
yeah.
always say, listen to whatever whoever's teaching you or whoever you're learning from, listen to what they have to say, take their advice, ask them for, the most important things that they expect from you as a student. And then once you become a graduate, you'll learn how to scan your own way. And that's the whole cycle of becoming a sonographer. OBGYN is just special because it's the one thing I think that ultrasound is most known for, and it's a lot harder than it looks. But we make it look easy. We make it look easy.
Mm-hmm. And for those who are listening, Leah, she is in our episode 14. So if you want to check out her experience, she is in OBGYN sonographer, as well as, is she still training for MFM, or is she
I don't know if
done?
she's training anymore. I think she might be done.
She might be done.
But
So
she was training,
check out that episode for her experience if you're interested in OBGYN, MFM, and stay tuned for future episodes for another OBGYN sonographer.
Yes, we're going to have another sonographer on that will talk more about OBGYN for you guys. But just know that OBGYN, it's a great field. It is a specialty part of ultrasound. And even if you want to do other things, you can still do other things because with OBGYN, you're going to learn all of general sonography. You're not just learning OBGYN, you're going to have to learn every single thing in a general program on top of OBGYN. And then once you graduate, you can specialize in OBGYN and only do OBGYN if that's what you so choose. A lot of people ask me, can I do OBGYN and other things? Or what if I don't like OBGYN? That's totally fine. You can still be a general sonographer under RDMS. And all you have to do is take the exam for OBGYN to be registered in OBGYN, and then take a registry in another specialty like abdomen, or you can take vascular if you want. You have the whole entire ardms.org website for you to see all the things you can register in, and you don't have to be registered in OBGYN to work at like an OBGYN office unless they require it, because there are some places who have sonographers who are not registered. But I think if you do get registered in OBGYN, it will benefit you in the long run, as well as make you very desirable for these places to hire you. Because there are some people who don't have that registry and still scan OBGYN patients. Like I do not have OBGYN, but I still do pelvics and OBGYN in the hospital setting. So just think about your options and ask around, ask your teachers. Hopefully you'll become an OBGYN sonographer one day if that's what you want.
Yes. And I'm just listening to you. I was like, oh yeah, that's right. All right. So that will wrap up our OBGYN MFM episode. And I feel like we can definitely talk more about this in a future episode and with guests and without. So if you want to hear more about this topic, let us know so that we can create another episode on this for you. So thank you so much for tuning in, watching. If you're watching this on YouTube, please don't forget to subscribe to Giselle's channel for more episodes and for more of her contents. And I believe you have a new video out, right?
Yep. Yes. I have 2 new videos out.
Work-life balance, right?
Work-life balance, and the new EagleView probe, if you guys want to check that out too. So
yes, check it out on her channel. And then if you're listening to this on any podcast platform, please don't forget to subscribe, set your notifications. I don't think you set your notifications. Rate us, write us a review if you can. We greatly appreciate it because we're doing this for you. Like hopefully it helps you.
Yes.
So thank you.
Thank you guys. And
Until
we'll talk
next
to you
week.
guys next time.